I was born to drive. The insanity outside the car and the peace inside the car. It's better than any roller coaster I've ever been on. I am a second-generation drag racer.
I'm a steam fitter, plumber, boiler operator.
Father, husband, son.
It used to be Joe and I, and now it's Joe taking care of Dad and the race car.
Family involved in car racing is like motherhood and apple pie. It just goes together.
We have a picture somewhere. He was 3 years old, sitting in the race car, trying to drive.
Dad's been the patriarch and general manager. He also would help back me up after a burnout, make sure I'm right in the groove the way I should be.
I can't do that anymore. I sit in the tow vehicle.
Helps line me up on the starting line.
They kind of frown upon oxygen bottles on the starting line.
Offering advice and support back in the pits.
Focus. Just focus on what you're doing.
Sometimes just a pat on the back and good job, kid, you know. I love NHRA drag racing.
My wife and I both were into drag racing.
You need to have earplugs first and foremost.
It's different than most other sports.
Do you guys have halftime shows?
It's an invigorating experience, to say the least.
1 part car race, 1 part carnival.
It is sometimes like a circus for sure.
1 part car show. Every ticket's a pit pass. You get to your seats early because that first pair of Top Fuel cars is coming down the track right after the national anthem. You can wander through the pits and you can shake the hand of your favorite driver.
The race car drivers, clearly, they appreciate the fans.
Get to interact for a couple of moments. The fans get back to their seats, watch them run down the track again, wander back into the pits again, see what you didn't see in the midway, see a couple other teams working on the cars, talk to the drivers. You can watch your favorite driver win, say great job. You can watch your favorite driver lose, go back and say, what happened out there? Interacting with drivers and teams and sponsors is in the DNA of the sport. It's part of what you do when you come to a race, so fans are more open to any kind of interaction here.
Chronic Obstructive Pulmonary Disease.
COPD does cover a lot of different things.
I have pulmonary fibrosis and chronic bronchitis. That's qualifies me, per se.
It's an umbrella term that describes a number of progressive lung diseases.
25 or 26 million people have COPD. Out of that, maybe 14 million know they have it.
The most common symptom is breathlessness. It's a need for air. It's almost like feeling hungry for air.
If anybody ever wants to find out what it's like to have COPD, take a ballpoint pen apart, stick the narrow end in your mouth, close your nose, and just breathe through that and walk up a flight of stairs. You'll see real quick what it's like.
You're wheezing, you're short of breath. And they said, no, I'm like this. And they actually think that that is a normal part of aging. People do not understand that this is abnormal.
People just kind of rationalize it off as, well, you know, maybe it's just because I'm out of shape or I'm getting older.
In most cases of COPD are the result of traditional cigarette smoking. There are other causes, including genetics and exposure.
You can really slow the progression of the disease. In some cases, if you catch it early enough, you can almost stop it. I felt that it was necessary to have an organization that would focus primarily on screening and awareness.
Today there's 12 million Americans who are diagnosed with COPD, and there's another 12 million who have no idea that they even have it.
So there's a lot of people out there that don't know, and that's who we want to reach.
We have a platform that encourages fan interaction. We could be doing screening events right there where all those fans come through. Maybe a message on the Jumbotron, some PA announcements to come visit us in the Right2Breathe screening area in the Midway.
This is an example of what grassroots is. By reaching out to the people, by being right there, right in your face as they're going from the racetrack to the pit, this makes sense. It makes good sense.
When a fan enters the screening area, there would be a medical professional there to talk with them. We have a 5-question screener.
It's 5 simple questions.
It takes just a minute to answer. How many times in the past month have you been short of breath, for example?
The simpler the better, and these 5 simple questions can save your life.
If you score high enough, then there would be a breathing test on site called spirometry.
This is non-invasive, it is painless, it's going to be free.
We could provide for them resources and point them in the direction of education.
It's up to them to reach out to their healthcare providers and to get to the bottom of this.
We could send them to a Minute Clinic.
I think it would be amazing to implement this type of screening.
There's a need here. I would not have the opportunities I have today in racing if it were not for Mike Gillespie.
If you want the story behind it, Michael had cancer. He was in remission, bought the car, cancer came back.
Mike used to race Top Fuel in the 60s and into the 70s. He came into some money and bought this car. A lump appeared on the side of his head. He noticed another one under his arm. Unfortunately, it was cancer. Before he passed, he let me know he wanted me to continue racing.
So when he passed on, he gave us the race car, trailer, everything we would need.
He said, well, the only way I'll do that is if your name is on every car I drive. He didn't say a word, all he did was smile. While Mike was fighting cancer, I reached out to Jack Beckman, is a cancer survivor, and Mike really admired Jack. Jack did a national campaign for the Leukemia and Lymphoma Society. And I called him up and offered to use our car to support him in his national campaign. It really went well. That was the beginning of the concept of using the car as a communication tool. And at that time, my father's COPD began to progress, and it just made sense to begin doing the same thing with COPD. Drive for COPD was an awareness and screening campaign in NASCAR. The funding wasn't available to bring it to NHRA drag racing. I wasn't willing to give up. The success they had in NASCAR inspired me to bring that over here and to begin Right2Breathe as our own organization.
Right2Breathe will take advantage of the momentum that Drive for COPD started. It will touch the grassroots community and actually do screening and education and awareness in a very big way.
With COPD and some other breathing related issues, there's stigmas attached with it.
Came in and said, oh, I see you smoke. I would go, yes. My father died of lung cancer. He said, oh, he had cancer, that's it. Or he had cigarettes. He smoked, that's the problem. Don't write me off that way.
We don't ever blame the patient for their illness. It certainly doesn't motivate people to feel better.
Many people who were smoking and have COPD never even knew it was harmful because we had tobacco companies saying it's fine, it doesn't kill people.
Smoking for so long was thought to be very glamorous. My dad actually got diagnosed with COPD about 30 years ago. Having been a smoker, he was in the Army. The time that he served in Korea, they actually had K rations, and part of that was including cigarettes.
We want to look forward. We want to help people live now.
They all have a right to breathe, regardless of what the choices were they made.
I got the right to breathe like this, like you know?
It's a motorsports platform. It reaches an audience that is at risk for COPD.
Having the visibility on the Right2Breathe car, the kind of advertising that they would get from television time.
When your favorite driver has brand XYZ on his car, it helps create brand affection.
To see the cars and to see that there's a huge sponsor presence.
The professional categories, we need sponsorship.
A few partners to reach the NHRA fan base, reach some of the 12 million people that have COPD and don't know it, and make a difference out here. It's not a hard sell out here. There's such a wide, diverse fan base.
The cultural diversity, the diversity in age, the diversity in ethnic groups, the diversity in their income.
The multiple touch points during the day.
The pull-through, of course, is that they tend to visit these companies during the breaks in between the rounds of racing.
Being able to reach the fan as they go back and forth, so you have more opportunities to try to touch as many people as possible at the event.
If the sponsors are involved in the screening and patients are willing to provide their information if they're here at the track, that's an opportunity for them to follow up.
Consumer interest runs our market. By talking more about it, we can bring in more investment. We can drive the market to look for a cure.
There's a burning platform with COPD. COPD is one of the diagnoses that have been added to the Medicare readmission penalties. Now that that's in place, we'll start to see more involvement from some of the medical device companies and the pharmaceutical companies. Right2Breathe would help them bring more visibility to the general public about some of the things that they do to help treat patients.
There seems to be no downside.
If you have a concern, go in and get screened, because early screening can identify the disease. And even though there is not a cure for COPD, there is hope.
Get it checked out. Even if it's nothing, it's better to hear, I have nothing.
You're better off finding out sooner, because once that lung function is lost, you can't get it back.
I can't emphasize enough, the sooner you find out, the better off you are. I didn't find out till kind of late.
There are a number of treatments and lifestyle changes that can improve your quality of living, that can stop the disease, that can reverse the symptoms, that can allow you to do the things that you love to do, to thrive and to live, to breathe again more easily.
Better to know, and that way you can make a decision.
There is no downside to getting checked.
Get screened so you can get diagnosed early so that you can live a long and fulfilling life.
I want to keep driving.
I think we should absolutely support Joe.
I feel 100% confident he can do the job.
I was with the COPD Foundation before Danica Patrick was.
Very proud of him.
Everyone has the right to breathe.
The name of the organization is appropriately named.
It's a wonderful idea. By spotlighting what COPD is, those 12 million people who are living with this disease may actually be able to get help.
The fact is, everybody has a right to breathe. Smell the nitro.